Hi, my name is Michael Andrews.
Hi.
You are?
Hi, uh, I'm Hilmi, Hilmi Quraishi, Quraishi. I come from India, and I run a social enterprise called ZMQ, which is based out of India. It works in the mobile technology for learning.
Okay, so could you give me a description of this project that you're working on? What is it like? What is your audience? Who do you
See, we are working in India for last 8 years, and our biggest challenge was how to address the underprivileged communities and create a behavior change. It was in 2004, 2005, India was passing through a stage of HIV/AIDS pandemic, and we had a lot of media coverage in the urban areas, but we were not able to reach properly to the rural areas, especially the underprivileged areas. And it was the biggest challenge, how to reach there. We don't have electricity there, we don't have television there, we don't have newspapers there. It is basically media dark areas. But fortunately, we have mobile penetration there, thanks to the growing networks of mobile telephony all over the world, especially in the developing areas. So we thought, why don't we use this channel, exploit this channel, and start creating content on mobile learning on HIV/AIDS. And I think if we really want to address the communities who are poor, who are semi-literate, who are less educated, the best mode of education for them is through game-based learning. Because it is more of fun. It is not very strict learning. And so here started, and our initiative 2005 called Freedom HIV/AIDS, and started with the launch of 4 mobile games in the local languages, and later on we scaled to 16 mobile games on different aspects of HIV/AIDS. It was about prevention, it was about transmission, it was about myths and misconceptions, stigma and discrimination, and all. And I think it is not a difficult task to develop games, but the biggest task was how can we reach to these people and make it free or make it at a very low cost. So we tried to work with some of the mobile operators in India, and we convinced them over some time, and then we were able to give this game for 1 rupee or 2 rupee to the communities. And in last 3 to 4 years, of the initiative, we were able to reach to almost 27 million mobile handsets in India. And then later on, we scaled the program in Africa, in Kenya, Tanzania, and Uganda. And today, after 5-6 years of the initiative, we are reaching almost 65 million subscribers with more than 40 games on HIV/AIDS.
Wow, that's really amazing. So, can you tell me a bit about your vision for your venture?
See, our vision is that HIV/AIDS is a disease which is existing today. But if you see, there is a lot of linkage of HIV/AIDS and tuberculosis, and because people live in poverty, people live a really bad health state. So so it's not only about HIV. We are working right now on tuberculosis and malaria. And I think the biggest challenge for us is to address issues related to mother and child, because if a mother is healthy, she's going to give birth to a healthy child. And if the child is healthy, the rest of the life of the child will be very easy. As compared to a child who is undernourished. So now we are developing a series of games for mother and child. So here we have 2 strategies. First, we are addressing issues related to the mothers who are pregnant. We are giving the information through the mobile phones about pregnancy, about each and every month, and every week what all mothers have to take care of, during the pregnancy. And then, and once the baby is born, we give information about the vaccination, immunization, when the baby has to go for the polio drops, how long the mother should breastfeed the baby, about tetanus, about different type of inoculation and immunization. So our bigger objective is to create a channel called Lifeline channel, where every operator in the world connect with the people who are underprivileged through some kind of games and information, and those information should go free, because it is not about commercial games. It is not about something about business. It is about a social need, especially underprivileged people. So here, objective is to have a channel where anyone and everyone can access any kind of emergency-related information about pregnancy, about disasters, about education, about child health, and we call it a Lifeline channel. So now we have a new initiative called Mobile for All, which is basic. It is called Right to Information, Right to Connectivity. That if if I own a mobile phone in a village, I should not disconnect it because I don't have, maybe $1 or ₹1 in my cell phone. I should not be talking to my friends, but I should be getting information free on lifeline services like healthcare for mother, for child, for education, for disaster preparedness.
Okay, okay. Well, as you know, I am part of the Learners Voice program, and WISE recruits 30 of us each year. Well, this year was 30, last year was 20. Every year it's growing. Tell me about your thoughts on having learners involved in the actual creation of the new systems of education.
I think it is itself WISE is a fantastic initiative, and I think it has grown up really well in the last 3 years. And I see here the young learners, and I see that all the young learners will be the social entrepreneurs of tomorrow. So I think if we see what was the level of education 10 years back, we were all focused towards our profession. That anyone becomes an engineer or a doctor and then goes for a job. But I think today all these learners are more socially conscious about the rights, about human rights, about the needs of poor, about needs of so many underprivileged and deprived people. And I see this forum as a forum which can create really revolution in the field of technology and education, maybe through the Facebooks, through the blogs, through mobile technology, through e-learning, through simulations and all. And I'm sure that I'm going to see a much bigger delegate of these learners maybe in the coming WISE. And I'm sure you all are the ambassadors in your own countries, in your own universities, in your own departments, and you will be like the peer educators who are going to train the rest of your peers and team members in the classroom and the universities. And I think we'll have a very big learning community of social because here today we lack learning. It was all focused towards kind of of a professional objective. But I think we see there's a movement growing toward a social objective, which is very important.
Okay, okay. Well, on behalf of the Learners Voice, I would like to thank you for your time that you spent with us having this interview.
Thank you very much.
Thank you.
Thank you, Michael.